My name's Troy Wall, and I'm going to be demonstrating how to do a specimen and glucometer sample. So first, I want to introduce myself to the patient. Hello, ma'am. My name's Troy. I'm going to be your nurse. Can I have your name and date of birth? You want to verify that this is the patient. Correct name, date of birth. I'm going to go wash my hands and gather my supplies, and I'll be right back. So the sink would be in the room with the patient.
You get your blood sample and it says with some devices the blood sample otherwise just you don't get obtain test results. That's weird because this also says don't milk it first. My doctor's
Well,
like
never milk. You never milk because it
This is done in a clean technique, so I will use gloves.
So I guess it's
Since there is a bloody substance contact.
gently squeeze as opposed to doing this. Right. Do this. Oh my God! It hurts my own knuckle. You know.
So ma'am,
it's not
first
easy.
I'm going to check your blood sugar.
Right.
It's going to be a prick of the finger, and it'll give us a reading from your blood. So first thing I want to do is take an alcohol swab. I want to take the patient's finger. I want to apply the alcohol. Discard of that. I'm going to wait about 10-15 seconds for that to dry. Once that's dry, I'm going to take my glucometer. I'm going to take a test strip. I'm going to check the expiration. Expiration is good. I'm going to insert the test strip.
okay.
Then, I'm going to prick the patient's finger on the count of 3. 1, 2, 3. Once that's there, I'm going to obtain a little drop of blood. I'm going to apply the glucometer strip to the blood. It'll tell me when it's ready. It'll count down. 3, 2, 1. It's going to give me a reading. I'm going to document that reading. This, we're going to pretend says 101 milligrams per deciliter. At this point, I would discard the strip in the appropriate container. I would recheck the patient. If there's any bleeding, I would apply a Band-Aid. If not, then the patient's good to go. That concludes the glucometer. At this point, I would remove my gloves and perform hand hygiene. After my hand hygiene, I would reapply new gloves, and I would perform a urine specimen. If the patient can ambulate and they're okay with it, we'll do a free-flowing specimen for a urine analysis. We're going to collect 20 milliliters of urine. We'll have the patient either go into the bathroom or behind a curtain, and with the kit, they will clean themselves first with the wipe, and then during the middle of stream, we would have them fill up to 20 milliliters of the cup. Once they're all set and they're back in bed, we would take this, we would put the name, my initials, the date that it was performed, the time, and the patient's name and date of birth. And we would bring that down to the lab. If for some reason we can't make it within 20 minutes, it would then be placed in the refrigerator and be chilled. For a patient that cannot ambulate and has a Foley in place, what we would do is come over, we would clamp the tube after about 10-15 minutes until it's filled up into the reservoir. We would take a syringe for a culture and sensitivity. We would apply the syringe, and we would draw out up to 5 milliliters. This would then be put in a sample cup, and again, this would be disposed of in the Sharps container. That specimen, patient's name, patient's date of birth, my initials, date and time that it was performed. Again, 20 minutes, and then it has to be refrigerated. And that is a urine specimen. Next, for the sputum specimen, again, I would go, hand hygiene, come back, put on new gloves. What I want is I want the patient to sit up into a Fowler's, high Fowler's position. I want the patient to perform deep breathing. After about 3 breaths on the exhale, I want them to get as much mucus or sputum as they can up, trying not to get any phlegm, but the major mucus. And I would have them spit into the cup. Patient would spit into the cup. Make sure that the respirations and lung sounds are good after that. Patient's comfortable. Patient name, date of birth, my initials, time, and the date. And that would be sent down to the lab for testing. And that is for specimen.